Okay, I think we can get started now. Welcome, everyone. I'm Jennifer Boyko. I'm the Senior Manager of Scientific Operations here at the Canadian Longitudinal Study on Aging, or CLSA for short. Thank you for joining us today for the webinar, which is entitled Physical Activity Behavior in Middle-Aged and Older Adults. Before we begin, I want to acknowledge that the CLSA National Coordinating Center, as well as McMaster University, are located on the traditional territories of the Mississauga and Haudenosaunee Nations and within the lands protected by the Dish with One Spoon Wampum Agreement. As attendees of the webinar, I encourage you to continue learning following the webinar and to acknowledge the original inhabitants of the lands where we currently have the privilege to do our research, live, and work wherever that may be for you. Also, before we begin, I'd like to review a couple housekeeping points that are also on your screen. First, everyone but the presenters will be muted throughout the webinar. If you need to change or test your audio during the webinar, you can click on Audio Settings on the bottom of the Zoom window. At the end of today's session, there will be a question and answer period. If you have a question for the presenter during the webinar, you can post it in the Q&A box, which is located in the bottom middle of the toolbar. The questions will be addressed at the very end of the webinar, though. Questions will also be visible to all attendees. So if you have any questions about the technical issues, please put those in the chat and put your questions for our webinar lead today in the chat box. What else? Finally, a feedback survey will be launched at the end of the webinar, and we invite you to complete it after exiting the Zoom session today. And this very brief survey provides us with important feedback that we can use to plan future CLSA webinars like this one. Now on to today's webinar, Physical Activity Behavior in Middle-Aged and Older Adults. The webinar is presented by postdoctoral fellow Cassandra Demore. Cassandra completed her PhD at McMaster University in the School of Rehabilitation Sciences in the summer of 2024. Her current research focuses on physical activity, aging mobility, as well as fall prevention. She is particularly interested in strategies that promote independence and enhance quality of life as we age, with an emphasis on preventative approaches centered around movement behaviors. So I will now turn it over to Cassandra.
Okay, hi everyone. Just give me 1 second here to share my screen. Okay, and hopefully everyone can see the slide. Not sure if I can get it okay for that. Okay, so as Jennifer mentioned, my name is Cassandra Demore. I'm a postdoctoral fellow here at McMaster University, working under Dr. Marla Beauchamp in the School of Rehabilitation Science. And today I'm going to be talking to you about physical activity behavior in middle-aged and older adults. So I'm going to start by giving us a little bit of an introduction on physical activity in case not everyone is as familiar with it. And then I'm going to touch on 2 of my papers that came out of my thesis work. And then finally, I'm going to provide a little bit of a snapshot of one way that we can involve our community members in secondary data analysis and finish up with some limitations, implications, and next steps for myself. So physical activity, before we begin, I want to make sure we are all talking about the same thing. So I'll be using the World Health Organization's definition, which is any bodily movement produced by skeletal muscle that requires energy expenditure. So this is actually a very broad term that relates to more than just exercise. And one of the main ways we talk about and measure physical activity is through the term intensity. So we can see here on the screen a scale of intensity, starting from the far left, which includes sedentary activity, and then 3 levels of physical activity: light, moderate, and vigorous. And so as we move along our arrow to the right side of the screen, these activities require more energy or more effort for us to complete, with vigorous being the most intense or requiring that most amount of energy, and sedentary activity itself requiring the least amount of energy or being the least intense. Now, one of the other terms in the physical activity literature that's really important and comes up a lot is this term inactivity. And this is actually defined by an individual who does not achieve 150 minutes of moderate to vigorous physical activity in a week. And we know based on this definition that 1 in 4 adults worldwide are considered inactive and not reaching this amount of physical activity in a week. And we can see that reflected here in Canada. Here we can see that for all our age groups and regardless of sex, we have a percentage higher than 25 for the number of people considered inactive. And there's two other really important trends that we can see here in Canada, and that is that our older age group, so this second bar here where we're looking at 70 years and older, have a greater percentage of people considered inactive, as well as if we look at it by sex. So we can see these pink bars here who represent our females, again, have a higher percentage in both age groups who are considered inactive. And this is unfortunate given the limited amount of evidence we have specifically for females, as well as what we call disaggregated by ages. So when I refer to that, what I'm saying is we want to know, rather than older adults as a group, are smaller age bands such as 60 to 65, 65 to 70, how do they actually do their physical activity? Now that we know what inactivity is, I have the unfortunate news of telling you that inactivity is a global health crisis. In particular, in high-income Western countries, we have evidence showing that our inactivity levels have actually been increasing. Specifically here, we see that for females and males from 2000 to 2015, we had about a 5% increase in inactivity levels. And this is unfortunate given this greater relative burden in high-income countries. And one of these reasons could be due to the percentage of deaths in Canada due to non-communicable diseases. So inactivity is having a greater burden on high-income countries like Canada, where we have this high non-communicable disease causes. And so the reasons we care about physical activity is because physical activity is associated with numerous positive health benefits. We know that higher levels of physical activity can help prevent chronic diseases such as diabetes and cardiovascular health. It can improve our functional status through muscle strength and balance. We know it helps with social outcomes like loneliness, and we also know it can improve psychological health. So we've seen associations with both depression and anxiety. And for today's talk, we also want to note that physical activity levels have been shown to improve trajectories of healthy aging. So from a recent study that looked at the evidence from 8 different cohort studies, they showed that when we looked across years and we looked at our healthy aging score, that individuals undertaking any level of physical activity had an increased odds at being in the stable high trajectory of healthy aging. Now, on the flip side of that, when we talk about increasing physical activity levels, we hope that we are also decreasing inactivity levels. So the number of people reaching that 150 minutes increases. And we know that this marker of 150 minutes helps decrease the prevalence of non-communicable diseases. So we talked about that high prevalence in Canada here. So this is one way we know we can help decrease that prevalence, which could therefore help us decrease the burden on our healthcare systems. In a recent paper that came out in 2023, they showed that the healthcare costs estimated from current inactivity prevalences in Canada between now and 2030 was over 500 million per year here in Canada and over 37 billion Canadian worldwide per year between now and 2030. And when we look at overall the healthcare costs associated with inactivity, we can see that the majority of healthcare costs is actually landing in these high income countries, where 63% of this cost going to them. So with all this information in tow, we created my thesis, which had a couple specific goals or gaps I was hoping to start to address in the literature. So one of the first ones was understanding what people are actually doing. So beyond this 150 minutes cutoff, what are people actually doing in the different behaviors? And importantly, as I mentioned early, I really wanted to address older adults and females. And in the context of Canada, as we saw, we have such a relative burden for inactivity, and limited evidence more so in our older adult populations. So these are the areas I was hoping to build in for my thesis. So a comprehensive understanding of what people are doing, looking at female subgroups, as well as doing that age disaggregated analysis. So looking at smaller bands of age. So today I'm going to be talking about two papers that went to try and address this work. The first is looking at normative values for the physical activity scale for the elderly. And the second is where I tried to describe the physical activity behavior in middle-aged and older Canadians. So both of these papers were done in the Canadian Longitudinal Study on Aging, which is the reason we're all here today. So I'm not really going to go into depth about the study itself, but as a reminder, at baseline, we had just over 51,000 participants who were 45 to 85 years old. The work I'm presenting today does focus on baseline data, but the one thing I want to highlight about the study today is how we've measured physical activity, at least up until the most current follow-up. So at baseline, or more specifically, the Maintaining Contact Questionnaire and Follow-up 1, participants in both cohorts were offered to complete the physical activity scale for the elderly. So that's what we're going to be working with for the next two studies. So the physical activity scale for the elderly, which I'm going to refer to as PACE, is a 7-day retrospective questionnaire. So it asks participants about what they've done in the last 7 days specifically. It was designed to be more reflective of older adults in particular, based on the examples they provided and the types of activities they included. It has been used in over 35 different countries and has numerous translated versions. Now, it consists of 10 questions, which cover 13 items or activity types. An example of some of these questions is on the right-hand screen here. So there's about 5 questions where we get a little bit more detail on what people are doing. And from these 5 questions, we get a frequency as well as a duration, and it's an open-ended question on what types of activities they are actually doing. Now, for the activities that were included, this is one of the aspects that kind of goes into the pro columns of the PACE because it has such a wide variety of types of activities as well as intensity. So for example, we have light sport all the way up to strenuous sport and recreation. We have caregiving duties. We have work. We have home care. We also have sitting, which is a sedentary activity. Now for today, we are focusing on physical activity. And so I'm going to be talking about the total PACE score. So that includes 12 of those 13 items because it doesn't account for sitting as it's a sedentary activity. Now the total PACE score ranges from 0 to over 400. And we know that higher scores means a person is more active. However, the score itself doesn't have any units. So we don't know based on that score how much time they spent or how much energy was required to do all these activities. We just know that 400 means they're more active than 10. Now, from a recent scoping review that some of our team members did, we were able to look at the breadth and extensiveness at which the PACE has been used, and we found that multiple versions of the PACE have been shown to be valid and have strong test reliability. If you want more details on that, that is available open access, so I'm not going to go into too much there. But this brings me around to the first paper I wanted to discuss today, and that is the normative values for the physical activity scale for the elderly in men and women 45 to 85 years old. So the objective of this paper was to create age and sex-specific normative values for the PACE for community-dwelling people aged 45 to 85 years old using the CLSA. So normative values provide a reference base on a healthy population that allows for comparison to a standard and can be used to indicate whether something is amiss or in need of intervention. One great example of normative values that a lot of us are familiar with are the height and weight growth curves that we use to monitor children's growth. So that's one example is on the right-hand side here, where we have the age of the children on the bottom, and then up the sides, we have either their weight or their height. And doctors and healthcare providers can use this to track their age, their height, or weight, and see where they fall compared to a healthy or normal individuals. And this can help play an important role for monitoring the progress of health characteristics and identifying individuals needing investigation or maybe an intervention. So for this analysis, we had to identify or decide what our healthy or our normal or average population was going to be in the context of physical activity in an aging population. So we defined this as anyone who did not experience physical activity restrictions. And this was done by excluding individuals who had a mobility limitation, specifically used a gait aid, or reported a limitation in any basic or instrumental activities of daily living. Additionally, anyone who had missing data on either of these or had an incomplete physical activity questionnaire, they were excluded from this analysis. Now, we did check the validity of this exclusion criteria, and we saw that for the total sample, as well as by males and females, that the individuals identified as having a physical activity restriction did have a significantly lower physical activity level compared to those included in the sample. So as I mentioned, we did stratify this by sex to kind of hit one of those goals we have for this work. And then in order to create the normative values ourselves, we followed the protocols and methods that were developed and laid out by some of our co-authors, but particularly led by Dr. Alexander Mayhew when she put out this first paper here, looking at normative values for physical performance measures in the CLSA. And we were lucky enough to have Dr. Mayhew come on our team and help us run the code and run these analyses. But the model was decided on based on looking at quantile regression-based models, as well as general additive models for location, scale, and shape. And this did use cross-validation, where we had a 70% training and 30% test. Now for this analysis, we had a total of 36,701 participants included after our restrictions, and they represented just over 9.5 million Canadians, 45 to 85 years old, without physical activity restriction. Now, the one characteristic I wanted to highlight based on its relevance to this work was the percentage of people who felt that the physical activity they reported over the last 7 days was reflective of their last 12 months. And so that was pretty high at 70%. Now, what we were able to do with this analysis is similar to the growth curves that I showed on that first objective slide there, was create charts as well as tables where we listed the total pace score for each age and percentile. So I have one example here for our female growth, our female percentile curves, where we have our ages along the bottom and our pace scores along the vertical axis. And here we can see the different percentiles for each age going from the 95th all the way to the 5th. So one of the first things we noticed when looking at these curves was that regardless of the fact that these individuals weren't experiencing any physical activity restrictions, even amongst the most active, if we look at the 95th percentile, we see that our physical activity was still decreasing with age. We also noted this idea that age might be really important to consider when we're comparing physical activity, and there might be a little bit of an unfair penalization to individuals if we're just treating everything the same regardless of age. So a great example of this would be if we looked at a single score of 172 on the PACE. So if that score was achieved by a 45-year-old female, she'd be about the 50th percentile for her age. Now, if we look at an 85-year-old female, she would land around the 95th percentile for her age. So the 85-year-old is doing really well comparative to her age group, whereas the 45 is running more in the middle of the pack. So in summary for this first paper, this was really the first to look at age and sex-specific normative values for the PACE from a population-based study. It helps to increase the interpretability of that total score and then hopefully the utility of the PACE. And then even amongst those without PA restrictions, we did note that there is still a downwards trend in physical activity levels with increasing age, and that females had consistently lower physical activity levels than males, which is similar to the previous literature. So now I'm talking about my second paper, which was looking at physical activity behavior in middle-aged and older Canadian women and men. And this was meant to be more of like a descriptive deep dive rather than looking at mean values. So we really wanted to describe a full spectrum of usual physical activity by the type and the amount. So we had two specific objectives that we were looking at. The first was to explore physical activity behavior in Canadians using subgroups of known correlates of physical activity. So we had individual level socioeconomic variables, as well as neighborhood level, and then age and sex, and region and season. And then in order to look at the amount, we also looked at quintiles of physical activity scores. So for this sample, anyone who completed the maintaining contact questionnaire was eligible to be included. So we had just under 48,000 participants. Of those, 633 were missing their total PACE score. Now, based on looking at the missing data, we did decide to go with pairwise deletion. So that does mean that for some of these different analyses, there are different sample sizes. Now, to get to the gist of it, which was to try and capture this comprehensive description of PA, we looked at 4 different physical activity outcomes. The first is that validated total PACE score. Secondly, we looked at the proportion of PACE score from each activity, meaning the percent of their total activity or their total physical activity that was made up by each type. And that goes from 0 to they did not do that activity to 100%. That would be the only activity they did. Third, we looked at the prevalence of each activity. So just yes or no, was that done in the last 7 days? And then finally, we did operationalize the 150 minutes of moderate to vigorous physical activity, yes, no. So for this analysis, as similar with other CLSA studies, you'll see that we did have a very high percentage of self-identified European background, a high good or better self-reported general health, as well as a high post-secondary degree and diploma. So what I'm going to do to take us through these results is I'm going to highlight some of the key patterns or findings that we noted through all of these analyses. So the first thing we noticed was the presence of these social determinants of health and how they may be influencing physical activity levels. So a great example of this would be household income. So on the left-hand side of our screen, we have our sample divided into quintiles of physical activity level, where quintile 1 is our least active group and quintile 5 is our most active group. And then each of these bars are made up of the percentage of people from each income category. So we focus on our 150,000 a year income. We see that as we increase in activity level, the percentage of people in that group that are from this highest income increases. And we see the opposite trend is true when we look at our households that have less than 20,000 a year. As we become more active, that group has a lower percentage of individuals in this income category. And we saw a very similar trend in our education. So again, least active to most active, and our highest education is the white. So as we increase in activity level, we did see that the degree and diploma percentage increased in each quintile. Now, we found very similar patterns when we looked at the percentage of individuals who reported good health. However, when we looked at the percentage of females in each quintile, we saw that as physical activity level increased, the percentage of females in each quintile decreased. Now, we took a little bit of a deeper dive into some of those socioeconomic patterns. And we noted that the greatest difference in physical activity was found between the lowest socioeconomic group and the next level up. So if we look at household income, what we're seeing is that the difference between each group that are now grouped by income, so this is our whole sample, and this is the proportion that were in our highest income category, and their mean PACE score was 173. The jump down to 171, 156, 133, and then to our lowest income group, which was less than 20,000, we jumped to 105. So we saw that biggest gap in PACE scores between the lowest and the second level. And similarly, we saw this jump in the lowest in education to the second rung. Now, this could suggest that there may be a threshold of some form at which these variables have a greater impact on physical activity level, or maybe below that level, the barriers to physical activity are greater. And it might suggest more targeted interventions could be useful in these groups. Now, when we did look at age and sex patterns in physical activity, similar to previous literature, we saw that PACE scores decreased with increasing age, and regardless of the age group, females had lower physical activity. But one of the things we wanted to do in this analysis was to try and understand type of physical activity and how that played into different patterns. So here we can see on the left-hand side, these gray squares. The first chunk is for our female participants, and the second chunk is for our males. Each column represents an age group. So we go 45 to 54, all the way up to 75 plus. Now, the squares represent the proportion of total PACE score for males and females across each age group. And when we're looking at them, the darker squares indicate that a greater proportion of a group's total score was contributed by that activity. So I'm going to jump right to an example to just help us orient here. So for example, if we look at work, we see that for both males and females, the darkest square is found in our youngest age group, meaning that work contributed a larger percentage of their total activity compared to their older ages. And we can see there was a bit of a flip when we looked at light indoor activity, where as we got older, light indoor activity became more important to their overall activity level. We did also notice some trends between males and females. So, for example, we saw that both indoor light and heavy household work uh, appeared to be slightly more important for overall levels of physical activity in women than men, and same with caregiving. And we saw a bit of a flip when we looked at heavy outdoor activity, where heavy outdoor activity contributed a greater percentage of their overall activity for males, suggesting that there might be some differences in some areas where we could perform more targeted interventions between these groups. Now, the last pattern I'm really going to highlight in today is looking at regional patterns of physical activity. As we know, Canada is a very broad country with a lot of different geographical attributes across it. So we broke our sample into the BC, the prairies, central and Atlantic Canada in order to see if there was any patterns of physical activity. And what we noted was that when we looked at the whole year, so all of the sample, individuals in the prairies had the highest level of PEA on average. Now, what we also did in order to account for seasonality, as most of us know here in Canada, that depending on the time of year, the weather can be very different. And we have seen evidence suggesting that the time of year or the climate can impact physical activity levels. So then we took these groups and looked at their activity in each season, more or less. And what we saw was that there was a lot more variability in physical activity levels when we looked at it by season. So on the right-hand side here, we have each season that we created, as well as the region of Canada. And then along the Y here is our total P scores. What we found was that even looking at the seasons, Atlantic Canada still had the lowest physical activity levels 3/4 of the year. Now, one interesting thing we did note was that for Central and Atlantic Canada, their highest levels of physical activity were actually from July to September, whereas the prairies and the BC had their highest levels of physical activity in October through December, which again suggests this variability across Canadians that may call for more than just one national campaign and maybe some more specific targeted physical activity promotion in the future. So in summary, this analysis provided a comprehensive description of PA behavior in middle-aged and older Canadians. We saw physical activity patterns for social determinants of health. So we noted that threshold in our lowest category groups for those socioeconomic patterns. We saw that there was different types of activity preferences potentially between different age and sex groups. And we also noted that Canada, and when we speak about it regionally, may have some diversity in when and how we're being active across Canada. So I'm going to take a little bit of a turn here. So now that you've seen the two papers that I worked on and understand a little bit of what was done and how it was done, I'm going to discuss how I actually included a little bit of community engagement in this work. So before I get into the small snapshot of what it looks like to involve community engagement in a trainee project, I just wanted to briefly highlight that community engagement, also sometimes known as participatory research, co-design, there's a variety of terms, but it is really broad and can cover a whole variety of methods as well as when we're involving. So I've taken this table actually from a research brief that was published by the McMaster Collaborative for Health and Aging, just to give us a quick overview of the different research phases and different types of activities that people have already used community engagement in. Now, keeping in mind, my example was in a PhD project. So there was a couple restrictions when it comes to involving this into my work. So we did obviously have a timeline crunch because my degree had a certain end date, as well as financial. You only have so much money when it comes to PhD work. So what we managed to do was create a public advisory committee, and they were involved specifically in these two stages. So reviewing results, making sense of findings, as well as helping us come up with ideas on how we may translate this knowledge to the community. So in order to create this public advisory committee, this was done mostly through word of mouth, through groups at McMaster University. We said we were looking for individuals 45 years and older, just based on our sample age. We were hoping individuals would attend 2 to 3 virtual meetings. That would be 90 minutes over the next year. And then individuals reached out to us. The other way we did look at recruitment was through the Voice platform, which is hosted by McMaster's Institute for Research on Aging. And this is a pretty cool platform that helps researchers conduct meaningful community public engagement. It allows you to post opportunities onto the website, and then individuals who are a part of that community, who could be older adults, caregivers, members of the public, have the option to look at your opportunity and potentially reach out. I don't know all the details because I only used it for this one snippet, but I provided the link in case you're interested in looking at something like that to help you with something similar to what I've done. So what the timeline actually looked like for this community engagement is, as I mentioned, I did my recruitment pretty much when I was wrapping up the analysis for that normative values paper. And then we had our first meeting where we did introductions, physical activity, and talked about the questionnaire. And then after I finished the second analysis, which I just presented to you, we met again for an hour and a half. Now, the community public advisory committee had several goals. So during that first meeting, we set out that we wanted to ensure all our attendees felt appreciated and valued for their knowledge and experience. We wanted them to walk away with an understanding of what physical activity is and why it's important for them. And then we also wanted to identify at least one positive and one negative thing about the physical activity scale for the elderly, particularly. So this was done to help provide us with some context when we're looking at these results and understand how people who are actually filling out the questionnaire might be interpreting things. So each of the committee members had the opportunity to go over the pace, review the pace, complete the pace if they wanted, and then we got together to discuss the pace itself. And so we learned that they felt it was quite feasible and the timeline was good, but we also learned that some of the questions were confusing and the examples didn't make sense and they weren't sure maybe where to put everything. So it was just interesting to take that away when we move into our analyses. So for the second meeting, we obviously kept that first goal, but then we identified our next two goals that were specific to that meeting, which was to identify key messages to share with the community and to brainstorm ways to share results in a meaningful way. So again, in this meeting, we had really rich discussions about the results, what surprised them versus what surprised us, which we had some misconceptions of going into, and learning what they thought might be important to share and who could value or gain value out of this information. And then we kind of discussed different ways that we were thinking about going about sharing this, and got some feedback that yes, an infographic could be good, but you really need to make sure that the language and the images that were done were understandable to the community. And that's where we are right now in our path, is we're working on creating the infographic. So once that's done, I'll be sharing it with the advisory member first, and then giving them the option if they would like to participate one more time in a survey to get feedback on it. But briefly, I want to talk about how I managed to do all of this. So for me, I was lucky enough to apply and was accepted into the McMaster Collaborative for Health and Aging Partnership and Research Fellowship here at McMaster. And this provides both financial and experiential support. So it provided me with a bit of funding in order to support my advisory committee members. And it also provided me with support in planning and carrying out the planned community engagement. So I got to meet with the collaborative's older adult partners and get their thoughts and ideas on how I was going about my community engagement. I got to work with experts in community engagement at the collaborative to try and create this project and help me get through it the best that we could. Now, I do believe they're having another round of applications this spring, but I know this isn't available to everyone. And so I just wanted to share additional free resources that can be found on their website. So some of the trainees, including myself, as well as their older adult partners and some independent researchers, all came together to create these resources. So the first is a trainee workbook and as well as a meeting planner template. So the meeting planner template for me, because I did a public advisory committee, was really helpful in making sure I thought as much through as I could before venturing into this aspect. So as a reminder, obviously as a trainee, I had a limited amount of time and a limited amount of budget that I could put towards this, but still having the opportunity to involve community members in this analysis where you don't really get to interact with participants or see how they feel about things was really valuable. And I encourage people to reach out to the collaborative if they have any questions about maybe community engagement in their work as a really supportive group of people. So I'm going to bring everything back into the papers that I talked about today. So some of the implications of the work that we have presented. So first, we have our normative values for the PACE. So these normative values allow for consideration of variation in physical activity when assessing and monitoring levels over time. It also allows for a more individualized observation and more granular progress towards a goal. So by that, I mean, when we currently use our 115 minutes of moderate vigorous physical activity a week, we have a goal that they have to reach 150 minutes. And if they don't get there, regardless of their progress, it's just indicated as a fail. By using things like normative values, you can monitor the placement across multiple percentiles rather than above or below a single placement. And then finally, as I mentioned, increasing the interpretability of the total PACE score rather than just being a unitless measure. There's something you can refer to see where you fall, and then this will hopefully help increase the use of the PACE. Oh, and I see a typo, sorry about that. And then the second one is supposed to not say normative values again, but say the description of physical activity behavior in females and males in the Canadian Longitudinal Study on Aging. So from this study, we demonstrated that targeted physical activity promotion efforts appear warranted based on that variability of PA behaviors in Canadians, whether it be where they live, their age, their socioeconomic status. We really saw that diversity and some disparity in certain groups that could potentially benefit from targeted interventions. And additionally, something I didn't really talk about today was the relationships between PA behaviors and health outcomes. So we did see that limitations in mobility and ADLs, as well as chronic conditions, appeared to have relationships with physical activity levels. And so these really warrant further investigation, specifically through longitudinal analysis. So we can begin to understand the direction of these relationships, whether it's physical activity levels leading to limitations in mobility or mobility leading to decreased physical activity levels, or if it's actually a bit of both. Now, some of the limitations I do want to highlight with this work. So first, we have to talk about the sample. So we always have to remember our sample. So this was a CLSA sample, so we're remembering our high European, high income, high education when considering generalizing. And then in particular, when we talk about the normative values, we did restrict our sample to people who didn't have physical activity restrictions. So this means that if someone were to go and use those normative values who did have a physical activity restriction, the percentile may not be as meaningful to them, but it doesn't restrict them from using the curves to still track their progress. And the other big limitation that I wanted to highlight is physical activity measurement. So up to now, the physical activity in CLSA has been self-report, and self-report is great, and we have lots of evidence demonstrating that self-report physical activity outcomes are related to health outcomes. But it still does come with some recall biases and individuals maybe not wanting to answer questions in front of people. And so we might not be capturing their true physical activity and what they're doing. Now, one thing particular to the PACE is that it's only validated in older adults, so individuals 65 years and older, and both of our samples that we talked about today were 45 years and older. Now, the PACE itself has been shown to be really highly correlated with the International Physical Activity of Questionnaire, which has been validated in those 18 years and older. And in addition, when we look at the PACE questionnaire itself, we know that it's not that it took stuff out to be relevant to older adults, but added stuff in. we're not that concerned about how representative it is, but that validation work is still needed. And then because we use baseline data, we need to remember that this information happened prior to the COVID-19 pandemic. So the information we presented here does not reflect any changes that may have occurred during or have sustained post-pandemic to physical activity behavior. So next steps, for me personally, I'm currently working on a longitudinal analysis. We're beginning to explore some of that directionality. So we're looking at determinants and predictors of physical activity at time 1, and following that to physical activity behavior 3 years later. So we're beginning to try and understand the direction of these relationships, which is currently a large gap in the physical activity literature. We're also beginning to see a shift to 24-hour movement behaviors. And this really started to become a buzz, for example, when Canada released the new 24-hour movement guidelines back in 2020. So this is this concept of acknowledging that all of these different movement behaviors are interrelated. And if we're asking people to increase time spent in one activity, we need to take that time from somewhere else. So this idea of 24-hour movement behaviors is something I'm highly interested in, and some of our group will be looking at moving forwards. And the last area I want to talk about when we're talking about physical activity measurement is device measured movement behavior. So this is becoming more popular, and we see it present in more and more large studies. So this could be stuff such as accelerometry or GPS and tick watches. And we actually know that the CLSA in their most recent round of follow-ups was offering for the core study or the comprehensive group to participate in mobility trackers. So I'm sure we'll hear about that soon. But it's exciting to see that this new type of measurement is becoming available in larger cohorts to help us supplement our self-report information. So really quick, here are my references. And I just want to say a few thank yous. So first, I would really like to thank my PhD supervisor, Dr. Marla Beauchamp, as well as my committee members, Lauren Griffith and Dr. Julie Richardson, and of course, my co-authors, Alexander Mayhew and Parman Duranda. I also would really like to thank the Canadian Longitudinal Study Aging on team and their participants. They are amazing, as well as my public advisory committee members for being so open and having such rich discussions with us. And just acknowledge some funding from the CIHR through a Catalyst grant and the McMaster Collaborative for Health and Aging for providing financial and experiential support for our community engagement components. And that is it for my presentation for today.
Well, thank you very much. Definitely lots to take in, and we already have several questions, so I will help facilitate this part of the webinar. Just a reminder, if anyone has any questions, please put them in the Q&A box at the bottom of the screen, and we'll go through them one at a time, presuming we have time. So the first question isn't this a chicken and egg issue in part, i.e. where less healthy people, older adults, are less likely to engage in physical activity? How do you sort this out?
Yes, so that kind of gets into exactly what I'm beginning to look at. So when we talk about things at one time point in particular, we can't really tell which came first or what might be contributing to which. So those longitudinal analyses is going to hopefully help provide some information on that. But we do know it could be a little bit of both. It's not necessarily one or the other. So I agree, we don't really know. Chicken and the egg is a great example.
Fair enough. Okay, next question from Yaping. What are considered as moderate, vigorous physical activity? How did participants know they were meeting the moderate physical activity per day?
Yeah, so I didn't get into that too much because of the timing. Obviously, I already filled your guys with a lot of stuff. But so moderate to vigorous is an intensity, and there's different ways that we can measure it. Specifically for what we looked at using the CLSA, we have the PACE questionnaire. And so it's already designated things to moderate to vigorous. So when you fill out the questionnaire, there's specific activities that they code as moderate to vigorous or moderate sport and recreation, and then strenuous sport and recreation. And then we also included exercise, and then we included walking based on the new met values that were released in the new compendium of exercise for older adults. But intensity itself is more variable from person to person, and what might be considered moderate for one person might be considered vigorous or light intensity for another. So I think if you go with CSEP, they actually have some great tools about using ratings of perceived exertion to judge your own intensity.
And next we have questions about the norms. Does the paper, first of all, is that paper published yet? I think it is. Was that one of the ones posted? No.
No.
Okay,
it's
so it's not
it's
posted.
submitted.
Submitted,
It's not,
okay.
but it has been released in preprint. I cannot remember the server. I couldn't tell you how to get there, but it is preprint, but not peer reviewed. Yeah.
So does the paper include a norms calculator, one that you enter sex, age, and score, and then gives you the percentile? And how normally distributed were the data?
So it doesn't include a norms calculator. We have included the tables and the chart, but I'm assuming the table would be more of interest to you. So for example, we had all of our percentiles, and then we have the ages, and then we have the PACE score related to them. So we have for each age from 45 to 85, and then we have the 5th, the 10th, the 25th, the 50th, the 75, 80, I think it might be 90, 95. Sorry, I can't remember the exact percentiles, but those are all available in the table, but there is not actually a calculator.
Okay, and the next question is that notes that your physical activity data is actually self-reported, and is wondering how accurate are self-reported data, especially with morally loaded activities, and could any inaccuracies be correlated with social characteristics, such as the more educated subjects knowing what the right answers on physical activity are?
Yeah, so I think there's a lot of difficulties when it comes to self-report, but we have seen, so I'm going to focus on the PACE today. So we know that the PACE has moderate correlations with some accelerometry measurements. Again, it depends on what you're measuring. Were you looking at total physical activity? Were you looking at walking? Or were you looking at just moderate to vigorous physical activity? When it comes to reporting, yes, you're going to find there's some confusion. However, the CLSA does do it with an administrator collecting data, so that helps with the understanding and making sure things are coded or put under the right heading a little bit more than if they were doing it completely by themselves. I do agree that education might contribute to this a little bit. If you don't know what physical activity is, you might not think to list it. And so that's one of the problems we have with questionnaires. In particular, when we get into older ages, a lot of the questionnaires aren't as inclusive in the types of activities they include. And so we might be missing information on what they're doing in whole. And that's kind of where we see things like wearables and device measurement coming in, and might be a really great way to capture what people are really doing in the real world. But those come with a lot of burden and a lot of their own issues.
So for objective 2 in your study, you mentioned exploring material and social deprivation, but you didn't present the results. Why? And can you share what was found?
Yeah, so really it kind of came a little bit down to time. So for every one of those groups, we ran the exact same analysis for all of them. For the material and social deprivation, they did show similar trends, but nowhere near as strong or like as drastic. Again, this was a descriptive analysis, so I can't tell you statistically the differences between, we were just looking for patterns to try and understand these behaviors. But we did see that they followed household and education, but just not as defined, I guess.
And there's just a comment here that it would be fun to look at the longitudinal effects on cognition as well. So maybe something to keep in mind for the future. Okay,
Definitely
let's go
agree.
to, I think I have to reverse these. So actually, no, I'm just going to go in order. So what do you think about looking into sedentary behavior in this group?
So sedentary behavior is a separate construct from physical activity. So we always like to keep that in mind, and it's associated with health outcomes all on its own, even when controlling for physical activity. I think I think there is some, I'm trying to remember, I think there is a researcher who was looking at sedentary activity in the CLSA, and she's done some really, Isabella Rodriguez, maybe Dr. Rodriguez, I can't remember, but there are people already doing that. And I think it's important because, as I mentioned near the end, I'm really interested in this concept of your 24-hour movements, because we know when we're asking people to be more active, we need to take that time from somewhere. So the research is really starting to grow on the benefits of moving our time from one activity to the other. So for example, we've seen some research showing health benefits when we move a certain amount of time out of sedentary to physical activity, and that those benefits are greater if we move it into moderate versus light intensity. So we know that sedentary activity is important and that it's part of our lives and part of our days, and we need to make sure we're considering it when we're looking at movement behavior as a whole.
And now in the second paper, you spoke about physical activity behavior. You showed household income is correlated with physical activity. Household activity is also correlated with age. So did you also stratify by age household income? Lowest household income being less than 20,000 is likely more prevalent in the oldest old.
Yes, so we did do that as a sub-analysis that's will be in the supplemental when this paper is under review as well, just not yet published. And I'm trying to picture it in my head, so I unfortunately don't have it at the top of my head, but we did look at it, and I remember that it was still there, but I do think it was the jumps were decreased. So there was still a trend because keep in mind it's household income, so just because one person might not be working, someone else in the household could still be working. So I think, yeah, it might not be capturing income specifically, but either way, the relationship was still present, but I believe it was not as strong.
And we have two more questions. So if anybody, just a reminder, if you have any questions, please feel free to post them. But if you are going to be dropping off, I also would like to remind you to complete your survey on the way out. So next question, what do you think about intersectional theory? What other sociodemographic factors are associated with inactivity in female, middle, or older age adults?
Sorry, I got a notification right at the end. So intersectional theory, and then what was the second half of the question?
What other sociodemographic factors are associated with inactivity in female, middle, or older adults?
So there's some really good work done by Rachel Coley, who is at, I want to say maybe StatsCan. She's done some work on looking at intersectionality in the Canadian Community Measurement Survey. I believe that's the one with the accelerometry, and showing that similar to what we saw, that we have this like grouping of household income, education, sex, and age. I think looking outside to include kind of what we saw a little bit was some of those mobility limitations. And I think right now it's hard because we don't have as much in this analysis that I did, but moving forwards, I'm going to look at some more environmental things in their community as well. You know, barriers to different areas, walkability, safety in the neighborhood is a big one. So I think there's more that could be at play. Whether or not that's being captured by things like your household income and your neighborhood, I'm not sure yet.
And another question from the same person. Do you know about CHAMPS? Is that I believe that's an acronym of something. Would CHAMPS have a better measure of physical activity compared to PACE in this population?
So CHAMPS is another physical activity questionnaire, and I believe it is the one with a lot of questions. It was a while back when I looked at all the different questionnaires. So I think CHAMPS, if I remember the reason I wasn't as big of a fan, was just due to the volume of questions and kind of the burden on participants. But it's also an older adult specific questionnaire. So it should hopefully have that breadth of types of activities and intensity to try and capture a more inclusive measure. But I can't remember if it includes light intensity or not.
When looking at physical activity by region, was age controlled for, so the Atlantic Canada being older than, for example, the prairies, which has the youngest population?
Yeah, no, so unfortunately we didn't account for age. It was one of the things we kind of discussed that and maybe like socioeconomic status when Atlantic Canada came out so much lower, but we didn't unfortunately control or like do a analysis with age as well as region.
And it's been confirmed that Champs does have light physical activity,
Okay.
FYI. Thank you very much, Nicole.
Thank you.
Okay, so maybe the last question, or two questions. Did you look at differences in physical activity by ethnicity?
No, so our samples were 96, I think it was 96% European or background. So we didn't really have the sample size to look by ethnicity, unfortunately.
When we measure physical activity objectively by accelerometry in older adults, we often see very little vigorous physical activity defined as METS 6+. Did you see older adults self-report very much vigorous activity on the pace?
So the vigorous physical activity, the only way to really get at that in the pace is when we look at sport and recreation. So because everything else is a predetermined weight and we can make assumptions, but we don't actually know. For example, like household work or walking for some individuals that may be vigorous, but we don't know using the pace. I don't remember it jumping out at me. I know the trend was that it was contributing less to their overall physical activity when we looked at it by age. But I know sometimes with accelerometry, depending on how you're actually creating your cutoff values, it sometimes can misrepresent older adults, specifically kind of not counting something as vigorous when it would be for those individuals. So I think it's all still a little bit messy, unfortunately, when we're trying to define what is vigorous, what is moderate, and what is light in individuals.
Oh, last question, literally, and that's what she wrote. What is the normative value for MVPA or walking for this population? Do you happen to know?
No, so I don't. So the normative value for specifically moderate to vigorous physical activity in this population, I don't know if anyone has done that for moderate to vigorous physical activity. I guess the closest thing you could say, and again, not normative values, but just like a cutoff value would be the 150 minutes, just because that's what we've been pushing based on its association with different health conditions. Not necessarily, again, normal. It's like not normative, but it's a cutoff value specifically for moderate to vigorous.
Well, I think we will end the questions there. Thank you to everyone who provided questions. I always tend to think of the success of a webinar by the amount of engagement with our audience. So thank you again to our presenter today for leading the webinar, and also to our audience. I'd like to remind everyone, though, about the next deadline for data access applications, which is January 15th of 2025. You can visit the data access section of our new website to review the data that's available, as well as details about the application process. I'd also like to remind everyone to complete their survey upon exiting the session today. And our next webinar, our first of 2025, it will be entitled How Biomarkers of Aging and Self-Reported Health Respond to Guaranteed Income, Insights from the CLSA. And it will be presented on January 21st at noon, and will be presented by a trainee, Luke Dugnan, and Dr. Daniel Dedden, both from Dalhousie University. You can register on our CLSR website under the webinars tab, and also the link is in the chat box. And finally, just remember that the CLSA promotes this webinar series using the hashtag CLSA webinar. You can follow us using this hashtag on Twitter, or now X, at CLSA_ELCV. I hope everybody has a wonderful day.